Hi friends, it's Dr.Waks, naturopathic physician, happily retired. Today we will continue our education on the topic of the liver, and we will talk about hemochromatosis, natural treatment. This video is part 1. The standard treatment for hemochromatosis is phlebotomy. However, people asking me if there are any herbs that will help to deal with this condition, and the answer is yes. One is Taraxacum officialis, which is dandelion, and the other is Arctrum lapa, which is burdock. One is colagogue, and the other is caloritic, meaning that they will speed up, they will increase production and flow of the bile, which will clear faster substances, in this particular case, iron, out of your system. Before we go ahead and actually talk how to use these herbs, I want to bring your attention to several facts. Fact number 1, it is not a cure using this herb. It is treatment. And this, if you choose to go with this treatment rather than with phlebotomy, that means that you have to take those herbs for the rest of your life. Before you do that, you need to figure out how much you need, because the dose of the herbs will be very individual. The second point is you are going to use the side effect of those herbs as a result. So the side effect is meaning that iron will be cleaned out faster, and some other substances also could be cleaned out faster out of the bloodstream: vitamins, minerals, hormones, and drugs. If you are taking certain medications, especially life-saving medications such as Synthroid or a seizure medication, the concentrate or dose of the drug have to be increased. So it will be checked and then may need to be increased. So you have to talk about that with your primary care physician and informed what you are doing. Third part is some money is involved in the whole treatment. Phlebotomy is usually covered by health insurance. Herbs, you have to buy them yourself. You also may need to buy vitamins and minerals. All of that is out-of-pocket expenses. So keep in mind, it could be a little bit expensive for some people. So this is out of we're done with that. So let's go and talk more about those herbs. Now, dandelion and burdock. It's your obligation, if you choose to go with natural treatment, to learn as much as possible about those herbs. I have a couple lectures here on my playlist. For example, lecture number 15 on liver, where I talk about lazy liver and treatment. I talk about those herbs. This is the slide, dandelion and burdock. So please see. Also, in that video, I'm talking about side effect. I said, warning, you cannot take those herbs more than for 1 month, because you're going to have a side effect. And this side effect exactly this side effect you are going to use to deal with hemochromatosis. You will be taking those herbs for the rest of your life. So let's talk about those herbs. The first of all, you need to decide how much you are going to take those herbs. I recommend to start with 60 drops of each herb, so 60 of dandelion and 60 of burdock, and do that for 1 month. It will take about 1 month to reach a plateau, or to reach the concentration, desirable concentration of the herb in the bloodstream. So it will affect the liver, and liver will clean faster iron out of the system. However, it's not for everybody. Let me tell you the clinical case that I had in my life. Patient was in my office, about 42 or 43 years old, female. she came with the complaint of headache. I wasn't able to figure out what was the cause of headache, but at some point we were thinking about that it's emotional stress that she experienced because she had a hemochromatosis and went for the blood draw 4 times per year, quarterly. She said it's a traumatic experience for her because she was doing that maybe from age 13 or maybe even earlier, and now she's 42 or 43. So all of these years, 4 times per year, she goes for the blood draw. So she said that there is not a single vein in her body that have not been poked, and that creates a lot of stress. And when I said that these herbs will clean iron out of your system, she immediately jumped on these opportunities. Her thinking was she would either decrease number of blood draws per year, maybe we'll go from 4 to 3 or maybe even to 2. That already was great help for her. Or maybe she would be able to control it with the herbs totally without phlebotomy. So we started with 60 drops of each herb per day. We did it for about 1 month. She went and she checked. It was not, the concentration of the herbs was not enough. So we increased the dose to 120 drops of each herb per day. After 2 or 3 months, what happened? She plunged into anemia. So at that time, we decided that her dose is somewhere between 60 and 120 drops of each herb per day. I think we settled on 100 drops. She did it for a quite long period of time, and checking her blood concentration of the iron in the blood periodically, we find out that this was the right dose for her. Nobody does know what would be right dose for you. So it's up to you to try to figure out how much you need. So with that said, make a decision, do the research. And then if you have any questions, ask me here. All relatives links will be below. And just like, subscribe. I want to tell you that the next video, what I will do, I will explain you how to make your own tincture to make sure that you can cut down on expenses, because buying those tinctures online is quite expensive. So what I will do, I will teach you how to make a standard extract of those tinctures. So you will do it yourself, and then you will have a lot of that in bulk. And that will be the next part 2 of this presentation. Thank you very much. Bye-bye for now.